Assalamu alaikum jami'an and welcome everyone in another episode of Ask a Doctor. As you know, we are still in November, which is the awareness month all about men's health. And it's an honor for me to introduce Dr. Farhad Janahi, who is a assistant professor of surgery at Mohammed bin Rashid University and also a consultant in urology and Mediclinic City. Dr. Farhat, it's not the first time that we have invited you in a podcast Ask a Doctor. You're actually one of the first who we interviewed. We talked about prostatic cancer at that time. We would like everyone who's hearing us today to also look at the podcast Prostatic Cancer, as it is very informative and important. But today we're going to talk about benign prostatic hyperplasia. So it's a pleasure to have you, Dr. Farhad.
Thank you, Dr.Lamees. Thank you for having me again. It's my pleasure to be here today.
So going back to the topic, we have received a lot of questions from the audience who were following me on the Instagram channel. And they want to know actually what is benign prostatic hyperplasia. So can you give us an overview of what it is and how it differs from prostatic cancer, let's say?
So about the prostate, prostate is a gland which sits at the below the bladder, and the urinary passage, the exit of urine, passes through the prostate. So the function of the prostate is to produce about 70% of the semen, the ejaculate, okay, which is nutrients for the sperms, which comes from the testes. Um, Prostate disease, we classify them into three. One is prostatitis, which younger people get it and can be symptomatic. Then prostate cancer, which we spoke about it before. It usually happens, it's rare to happen below age of 50 and usually asymptomatic. And then our topic today is benign prostatic enlargement. Okay. And benign prostatic enlargement is a natural phenomenon. Okay. It starts, prostate gets enlarged as we get older. And it usually starts to get larger after age of 45. And that can cause symptoms to the patient.
Um, Dr. Farhad, what kind of symptoms and signs would we expect in someone who's having a prostatic enlargement, prostatic hyperplasia? And do they come soon, like in early stages?
Yes, so prostate enlargement, as the prostate gets enlarged, it puts pressure on the water passage, on the urinary passage. Okay, and as we said, the urine passes in the middle of the prostate. So prostate is the size of a walnut juice. Okay, and as a male person gets older, the prostate gets bigger, and sometimes can get bigger from inside. So this water passage becomes narrow, and the patients, the symptom that they complain of, the flow of urine gets slower, okay? Um, then they go regularly to the toilet, okay, because they're not emptying their bladder. They have this feeling of incomplete emptying, okay? So after they urinate, they feel there is something left that didn't come out, and they go again and frequency. And another one is that it wakes them up at night. So they wake up at night to go to toilet. So these are the main symptoms, okay? Also, I have to note that some people have large prostate, but they are asymptomatic. We don't need to treat them. We just need to reassure them. I have patients who came and did an ultrasound for different reasons, and they found that they have enlarged prostate. And when I ask them if they are asymptomatic, we say we don't need to treat them. So it's a natural phenomenon. But if it causes obstruction or obstructive symptoms, then that's the time that they need to seek help, and they need to see a urologist or their family doctor, and then we start to treat them.
Mhm. Dr. Farhad, actually, when you're talking, you reminded me of the symptoms that we can actually get in kidney stones. Or actually urethral stones. So, is that something that could be one of the differentials when somebody comes with those kind of symptoms?
Yes, absolutely. So anything that can block the passage of urine, okay, It could be prostate in an elderly person, or it could be many other. It could be strictures, infection that can cause similar symptoms. Yes. So if they are symptomatic, they need to see their doctors and they need some investigations.
Mhm. Dr. Farhad, how common is getting prostatic hyperplasia, benign prostatic hyperplasia in men? Is it something that every man is going to get? Is there any risk factors that increase the chance of getting benign prostatic hyperplasia?
So very good question. Yes. So every man will have some kind of symptoms of prostatic hypertrophy or enlargement. It's very common. Okay, some people have it very mild, some people may have very severe, and then the end of the spectrum is retention. When a man cannot pass urine and they are in severe pain and they come to the emergency department and they need emergency catheterization to pass a tube to relieve their obstruction. And
Thank
our
you.
aim is not
Yeah.
to get to that point. So
Mhm.
people who have symptoms, because it's a very slow growth, okay, it comes gradually, and they ignore, they're waking up 4 or 5 times a night, they're not being completely, and then suddenly it becomes complete obstruction and they end up in emergency department. So our aim is to prevent that to happen.
Mhm. Thank you, Dr. Farhad. This is really very important information. And I got a question from actually my teenage son, and he told me, can prostatic hyperplasia happen in younger adults, or is it something that only comes with age? And if yes, when does it happen?
Very intelligent question. Yeah. So when we talk about hyperplasia, okay, that is a histological diagnosis. Okay, that is when they look at it under microscope that they tell us the cells are hypertrophied. Okay, so that can happen earlier. I mean, earlier by early 40s. Okay, but the symptoms usually happen, much later, after age 45 and above.
Mhm. Thank you, doctor. And this actually comes us to another question here. You said that if somebody has the enlargement, but they don't have symptoms, they don't need to be treated. You just reassure them. How about those who actually have symptoms? What are the treatment options that they do have? And does it have any side effects?
Thank you. Just again we go back to the last question. So young people, young male in their 20s, what we get is another symptom, another disease of the prostate, which is called prostatitis, inflammation of the prostate, and that's quite common. Okay, those people, the prostate is inflamed and can cause similar symptoms. Okay, and the treatment of that is completely different than the prostate enlargement. For prostate enlargement, so first of all, we assess the patient, we assess the size of the prostate, and usually we do a test called the urine flow test, okay? And another test that we do to see how much remains after they avoid urine. So these are the tests that give us an indication how symptomatic, how bad is the obstruction. So after those assessments, sometimes we may just need to reassurance, some lifestyle changes like reducing caffeine, okay, not to drink water before going to bed. So if we can treat them that way, conservative management. Then if still they are symptomatic, then we start with some oral medications, okay? We have different medications for them, and the urologists usually prescribe either herbal medicine or some kind of medications. And some of them, they may need procedures, surgical procedures.
Okay. So surgery is not for anyone, right? I believe it depends on the clinical status of the patient.
Absolutely, absolutely,
Mhm.
and the option and the patient's wish. So some people don't like to, because once you start this medicine, it's a lifelong medication.
Mhm.
So some of them are young and they don't want to get the side effect of the medication, and they may opt for surgery. Or people who have severe obstruction, okay, that they are nearly going to go into retention, acute urine retention. We offer them surgery. We have different surgical procedures. Okay, we in the long time ago. Okay, we used to remove the prostate. Then we have this endoscopical procedure, which we resect the prostate. Then we have laser, and we have a new technology called Resume. And this is where we inject steam, bukhar, into the prostate, and it shrinks that bukhar, that steam, will shrink the prostate. And this is proven to have no side effects, very safe. And this is an alternative to patients who are taking medications.
What's the name of this procedure again, doctor?
It's called Resume, REZUM of the prostate. It's a very safe procedure, and we do this procedure regularly. And it really doesn't have any side effect. This is a day procedure. We can do this procedure on patients who are on anticoagulation, such as aspirin or warfarin, and it's quite safe. It can be done as a day procedure, as I said.
Thank you, doctor. It's good to know that there are choices. And of course, medicine, as any other industry, is developing. And it's good to see those kind of changes in treatment methods. Dr. Farhad, is there anything that you want to tell because there's a lot of men and women as well listening to us today in the podcast. So is there anything that you want to tell them in terms of screening or early detection test that would advise?
I advise all our audience that make sure if they are men and listening, if you're waking up at night, going to toilet, if you feel you're not emptying your bladder, please consult your doctor. Okay. And for their female partner, the same thing. If you see your husband or your brother, they're frequently visiting, keep going to the toilet, make sure you advise them to seek help.
Doctor, I believe that some they're kind of shy to go to seek the consultant or the urologist because of the sensitivity of the examination itself. So, is there a new methods to detect prostatic hyperplasia, or does it have to be through digital exam? The clinical diagnosis.
Yeah, so many men are afraid to come to see a urologist because of digital rectal examination. Yes, we don't have to do digital rectal examination. Okay, now we have an ultrasound. Every urologist has an ultrasound in their office, so we can do a trans-abdominal. It's a simple test, okay, and we can measure, roughly a good measurement of the prostate and a good idea about the size of the prostate. And what's more important is we can measure post-void residual, and that determines how much is the residual urine after voiding, and that will give us a sense of how bad is the obstruction.
Excellent, excellent. That's good to know. And there's just one thing that passed by me now is when you talked about the lifestyle. So, your example said cut on caffeine at night, or maybe not drink so much water just before bed. What other, let's say, healthy lifestyle habits that men should consider to reduce their risk of getting benign prostatic hyperplasia?
So I'm not aware of there is any special supplement or anything that reduces the size of the prostate. There are some supplements such as saw palmetto is a plant extract which kind of have anti-inflammatory, and it eases the passage of urine. So it basically relaxes the prostate. Um, we advise all our patients to be healthy, exercise regularly, eat healthy. Um, but the main symptoms, if they have issues with the urination, okay, to seek help. And at that time, their doctor will order the appropriate tests.
Thank you, Dr. Farhad. I'm sure a lot of people have listened and benefited from this interview, short one. And before we end it, Doctor, would you like to give any other advice to the men who are listening to us today?
Yeah, so in my opinion, all men try to go to a urologist or your family doctor at age of 40 and do a check, a baseline test, an ultrasound, okay? And then from there, maybe annually, just for a checkup. It's nothing to lose. And as I said, They don't have to be examined by digital rectal examination, so they shouldn't be afraid of.
Thank you. Thank you, Dr. Farhad, for your time. And it was always a pleasure to have you. And inshallah, we're going to see you in another coming podcast in the future. I would like to thank the audience. And it's a pleasure to have you all. You can listen to it on the podcast channel, and also you can view it on the YouTube channel. So see you all and have a good day.
Thank you.
Thank
My
you.
pleasure. Thank
Thank
you,
you, Dr.
Dr.